I'm Theo Smith of the UAB School of Public Health, Center for the Study of Community Health. I have been working with Congregations for Public Health for the past 3 years on the Community Public Health Certificate Program. The purpose of the program was basically to offer or have a platform for ministers and pastors in the community to learn about health and health disparities. The way the program works is I coordinate professors and instructors coming from the School of Public Health and also other departments on campus, as well as other community groups such as the Jefferson County Department of Health. At the end of the year, the students who complete the program, all of the courses, receive a certificate of completion that is endorsed by the School of Public Health as well as Congregations for Public Health. And this certificate is presented during the graduation ceremonies at the Bible College, and those students' names are mentioned at the UAB School of Public Health convocation. So over the course of this program for the last 3 years, we've been able to touch about 150 ministers who've gone on to be pastors or assistant ministers at their church, and approximately 50 churches have been involved. We're here today to talk to Reverend Solomon, who's the Executive Director of Congregations for Public Health and actually the one who initiated the Community Public Health Certificate Program at one of the local Bible colleges. And I wanted to know basically what health issues that you saw in the community and the church that really interest you in starting something like this.
We in the African American community suffered a major health disparity. And when I got associated with the university here, it began to identify itself as a disparity that perhaps we could begin to do something about. I found over here at the university that they knew the answers to what the problems were, how we came about that situation, and even some recommendations as to how we might could change them. Only problem was nobody knew it but the university. It was time for us to find out what's going on over here and get involved. As you may know, in the African American community, the church becomes the place where things happen. In other words, the preacher has a built-in audience. There's some folk he's going to look at every week. And so why not begin dealing with the problem of health disparity in the church? Let us, those of us who preach, let us tell our congregations what we've learned, what we found out, and let's get involved with trying to do something about it right in our local church. Had not we been given the opportunity to create and put into play the program that we're doing at East Orange Baptist Bible College to test our theory of whether or not African American preachers would embrace, could hear, and could in fact be affected by what they learn about health disparity and take it to the community, we would not have known. But thanks to the university and of course you, Theo, and others, we did put into play a program at East Orange Baptist Bible College, and this is the 3rd year, where not only do they learn how to do the work of the preacher or the layman in the Christian church, but also the need to get involved with the health disparity in the community. So we've been doing that, and they graduate at the end of each session having their certificates from UAB and so forth. And it's impossible to do that kind of work without it causing some effect among those preachers who are trained. When they go wherever they go, they take health with them. And so when they become pastors, or if they're pastoring already, they themselves will include health ministries in their churches.
Right now, I'm just really thinking about being effective in the church. Really, I would love to get a health ministry going with the church that I'm with.
I decided to enroll in this class because I felt that I needed to know more knowledge about the things that's going into my body as related to the effect that it has on my body. I'm going to first use it in my home to make sure that my wife and my children are eating properly. And it will spread abroad. I do a ministry and I'll try to institute it in various places and also at my church.
We want those preachers to grab hold of what we've learned, and that is we've got to bring health disparity into the church through the preacher so he can pass it back out to the members and get us all involved. And what I hope is that eventually, down the road, every church will have a health ministry that speaks to health disparity.